Hello everyone, so this case will undergo immediate extraction, immediate implant placement, and immediate loading with an FP1 prosthesis. So the first thing to do in this case is to extract the lower left second and first premolars and the lower right second premolar in this manner. So this is the most important step. This is the first step of the surgery because these teeth will interfere with the occlusion of the opposing jaw. And then all the upper teeth are extracted and a fully reflected buccal flap shall be completed. And then we will go get the index onto the base guide. They fit like gloves. Note the index have occlusion mark with the opposing lower anterior dentition and has bone legs. So you attach it to the extracted reflected flap upper jaw in this manner, and you make sure that the legs are seated on the bone. And then since you extracted the lower teeth, it shall fit in like a glove. And then you have your patient bite, and then you pin your base guide. Once you pin your base guide, you ask the patient to open and you remove this piece, and voila. Now you can reduce the bone to the level of this guide. All right? And then what you need to do is to have the reduced bone over here. You are very sure that everything has been performed according to the guide. And then you start placing your implants. These will have angled multi-unit abutments, 30 degree on the posterior and 17 degree on the anterior. All you gotta do is just slide your implant placement guide. Voila. And then you place your implants and you make sure you do the timing marks. Once that is accomplished, then you could see that these are the multi-unit abutments, and this is the orientation of the screw to screw the multi-unit to the implant. And these are the 30 degrees. One is going backwards and one is going backwards. And then once you've done that, you attach your temporary cylinders and they will have this path of draw. And then the last step that you are going to do is the following. So now you attach your temporary cylinders. Just make sure you put a rubber down, and then you attach one cylinder at a time, and you have your prosthesis in the carrier. And once you know that everything is drawing and passive, you just seat it into position, just wiggle it through the holes, and then voila, everything is in position. Make sure it's all seated, and then you can pick it up with composite. You can reduce the height of the temporary cylinders. You can even widen the prosthesis palatally if you want to. You also have a spare prosthesis just in case this one breaks. If you want to secure this, you can use just buttons of composite, flowable, one here, one here, one here. And you have a spare denture if you want the patient to leave with teeth and you couldn't immediately load the case.